Hey y'all, hey. Welcome to the Med Spa Club with your host, Monica Swint. Let's get into it. Today, I got a hot topic for you. What we going to be talking about? Oh, baby, we're talking about the state of Black health. We know that we've been having this conversation for years and years as it relates to the health and well being and wellness of the African American community. Of course, because I am a nurse by trade, I'm always interested in bettering our health as a whole, as a community, and within our own communities as well. So, as we talk about the state of Black health, we're going to be talking about addressing some disparities and improving outcomes. How can we address the disparities and how can we improve the total outcome of the total health of the patient? So, let's go a little further. Disparities, we know really disparities have been going on in the African American community for years and years. But we know more recently, as COVID 19 came about a few years ago, it really showcased, highlighted the disparities in the African American communities, which is not a good thing. We already knew that we had a hard time getting top notch care. The money wasn't flowing in our community clinics. It's always been a battle of getting optimal care in the African American community. And also in the African American community, building trust in the client and our patient that comes into the clinics, because we know about the Tuskegee experiment and so on, other experiments that has been tried on the African American community for years and years. Therefore, we have a lack of trust. We're constantly building trust back in the African American community. With saying that, when COVID 19 came about, once again, it highlighted what's really going on in health and wellness in the African American community. Of course, African Americans were dying by the thousands in comparison to other um, races because, one, we have high number of hypertension, we have high number of diabetes, and these comorbidities were contributing factors of how your body responded to, to COVID-19 virus. The journey to better help the African American community begins with understanding the challenges and the opportunity that we face as a community. As we talk about the disparities in the African American community, we already know that in our communities, we face higher rates of chronic illnesses due to systematic racism, limited access of health care, and social economic factors. Exercise and healthy eating can help mitigate some of these issues. If we exercise, eat healthy, some of these things can be avoided, or we can decrease the amount of chronic diseases in the African American community. With saying that, it is known that in African American communities, once again, the fruit and vegetable selections are not as great as in other communities. Usually, we have to go outside to a higher income community to get great fruits and vegetables because they get the higher end fruits and vegetables, and they send the lower end to the African American community corner stores, and that's what the people buy within the community. Therefore, they don't have the better quality. They're getting not getting as much nutrients as other races. Some health conditions that are affecting the African American communities are hypertension, diabetes, obesity, and compared to other groups. Barriers to healthcare access and systematic racism contribute to health disparities. Once we've said that, it's going to come up again and again because it is what it is. Those are the contributing factors that show up in how African American, because we don't get the top-notch healthcare resources in our clinics, racism, being treated a certain kind of way because you are Black. Let's talk about maternal health. When you go and you have a baby, a lot of providers are ignorant to the fact that Black women, we're in labor, and yes, we feel pain. Yes, we want pain medication. Yes, we want our pain control. Of course, we know maternal death is at an all-time high. It's still high after we've talked about it years and years of why are African American women dying after childbirth. They're dying. They have internal bleeding. Their voices are not being heard because of systemic racism as it relates to health care. Community-based interventions in education can help address some of these disparities. As we are talking about the state of Black health, yes, we have the disparities. Yes, we have the systemic racism. We have all these things in place that are barriers that prevent us from getting the best quality care. At the same time, we still, as an African American community, need to take ownership of our own health. When you go and you see your doctor, it is up to you to talk about the things that bother you and be an advocate for your own health. It is up to you to understand when the physician or doctor give you a diagnosis of hypertension or diabetes, whatever the diagnosis is, for you to ask questions. If the doctor or provider give you medication for the new diagnosis of hypertension, you need to ask them, how does this medication affect my day-to-day life? How does this medication affect my overall health? Will it affect other organs by taking this medication? It is not up to the provider or the doctor to give you this information without you asking questions. It is up to you to be an advocate for your health, to ask these questions and say, how is this medication is going to affect my lifestyle? It's up to us. We have to take ownership of our health. We cannot and no longer leave the state of our health in someone else's hand. When you go to see your provider, make sure that you have your list of questions written down before you get to the doctor's office, because once you get there, that visit is literally 5 minutes or less, and 5 minutes being on the high end, that you need to make sure that you are getting what you're paying for, because whether you look at it that way or not, healthcare is a business. And you are spending your insurance money to see the provider to get the care that you need. You need to have your questions written down, ask your questions, and if it is unsettling to you, the answers that you're getting, you can be an advocate for yourself and ask for another provider, outsource referral. So, prime example, if you have a diagnosis of hypertension and you're on a medication, and every time you you're taking your blood pressure at home and or when you go to the provider, your blood pressure is still high 90 days later and they've tried different medications. At this point, you can ask and say, hey, listen, can you refer me out to a cardiologist? A lot of primary care doctors don't like to do that. And they'll just keep trying to tweak your medications until in hopes of getting your numbers down, your blood pressure down. But you don't even have to go through that. You can ask for a referral to see a cardiologist. A cardiologist is a specialist that specializes in the heart, that specializes in blood pressure, and they can get further testing such as echocardiogram, some other non-invasive tests that you may qualify for and or may need based on your diagnoses, but our primary care doctor will only go so far, and you can ask to see a specialist. This is our little talk about the state of Black health. We know about the disparities. We know about the racism. All of these things have been what they have been, and they're going to continue to be what they are. We have to take ownership, and you have to be an advocate for your health and wellness. And that's how I feel on it for today. Thank you so much for joining the Med Spa Club. Your host, Monica Swint.